The broadcast is now starting. All attendees are in listen-only mode.
Hello, my name is Mike Willett at the Intertribal Council of Michigan's National Native Network. Welcome to the NNN webinar series on cancer risk reduction in Indian country. This webinar is titled Strategies to Address Barriers in Pediatric Obesity and Food Access. This technical assistance webinar is being hosted by the National Native Network with Indian Health Service, Health Promotion and Disease Prevention, which offers technical assistance and resources for commercial tobacco prevention and control throughout Indian country, and the Indian Health Service Clinical Support Center. Your presenters today are Shelley Kubczak, Hannah Wichen, and Michelle Schulte. Shelley Kubczak is a consultant with Michigan Tribal Food Access Collaborative Project and a child care health consultant at the Michigan Public Health Institute. In 1990, she earned her Master of Arts from Central Michigan University in Public Health Education and Health Promotion. In 1989, she earned her Bachelor of Science from CMU in Public Health Education and Health Promotion. And Hannah Wichen, Master of Public Health from the Intertribal Council of Michigan. In 2018, she earned her MPH in Health Promotion and Education from Grand Valley University and earned her bachelor's in 2016 from Grand Valley. And Michelle Schulte, Project Director at the Intertribal Council of Michigan. In 2008, she earned her Master's in Curriculum and Instruction from Lake Superior State University, and she earned her Bachelor's in 2002 in Elementary Ed and Social Studies from Ferris State University, and her Bachelor of Science in 1994 in Sports Studies and Coaching from Central Michigan University. Funding for this There was no commercial interest support used to fund this activity. This activity is designated one contact hour for nurses. And to obtain a certificate for continuing education, you must be registered for the course, participate in the webinar in its entirety, and submit a completed post-webinar survey. Surveys will be sent from the GoToWebinar platform tomorrow into your email box. There will be a link there. So please click that link and fill out the evaluation, and we will be able to send out the certificates within about 4 weeks. By the end of this webinar, participants will be able to recognize the limited access to safe, nutritious food within Michigan tribal communities, deliver culturally relevant nutrition education to improve pediatric obesity care in tribal communities with limited staff capacity, and build a collaborative network focused on increasing community resources that promote health, education, and lifestyle. If you have any questions, please type your questions into the question box on the lower right-hand corner of your screen in the GoToWebinar platform. We will reserve about the last 10 minutes for questions and answers, and we'll go ahead and read the questions aloud for the presenters to answer. And now at this time, I present to you Michelle Schulte.
Hello, everyone. Thank you for joining us today. We kind of went over the objectives already, and you got to see a quick profile of just a few of the members of our Michigan Tribal Food Access Collaborative team. Right now, the team has been developed, is a collection of 6 out of 12 federally recognized tribes in Michigan. MPHI, the Michigan Public Health Institute, is one of our key members that supports us in evaluation, and we're always looking to expand the collaborative to make the work much more meaningful for communities, and then to spread the messages and the work that we're doing to more communities. Our Food Access Collaborative started probably about a year and a half ago through funding with the Michigan Health Endowment Fund. And our immediate goals were to formalize a food access community of learning. There are so many different layers to food access. I did a presentation not long ago on the importance of food access and how it affects a lot of our tribal communities. As we know, the research shows many of our tribal communities live in food deserts, and our low-income families struggle with trying to make things make ends meet. And with that, we know that they don't always have the healthiest choices available to them. And our children, rates of pediatric obesity are raising in many of our communities instead of going down. And so our goals were really to try and find programs and services and connect those with our families, and then also provide some education, not just for our staff and providers, but also for our families. And so there's many moving pieces to this collaborative, and we try to be open to, have people who are coming in at different levels or have different resources or responsibilities in their community to kind of put all these pieces together. We're always about trying to create an integrative community whereby especially our medical and our community health staff are working together in a more aligned manner. And we're also looking at organizations and groups outside of the tribal community to work with as well. With this project, we've done a number of community food resource assessments that we're really excited about some of the data that's coming out of here, and we'll share just briefly some of those results from those data pieces. And we're looking at increasing the proportion of local community food resource access points by about 20% with the tribal target communities. And so far, even just within the year, we're getting closer and closer if we haven't already surpassed that. We have a meeting coming up next year to see what our latest data is, but we've gotten pretty close to meeting that number even after the first year. The last objective that we're working on is increasing the number of educational resources relative to the developmental stage for dietary guidelines for Native Americans. Later on in this project, we'll talk about how we assess that and what we discovered. This just kind of gives you a map of the tribes in Michigan. The little tiny dots that you see are the federally recognized tribes. The ones with the stars are also federally recognized tribes, but they're the ones that are part of our collaborative currently. So we have two main geographic areas in Michigan, one of them being the Upper Peninsula, which is that little piece of land that kind of looks like a deer. We have 3 tribes that we're working with up there, and then in the Lower Peninsula, we have 3 tribes that we're working with. And they're a nice mix of tribes in that, there's 1 or 2 that have service areas that overlap into urban areas. And then the majority of them are in rural or very rural areas. In the state of Michigan itself, some of the challenges that we face, not only in developing articulation or partnerships with the state as tribal communities, is the fact that the state itself really doesn't have any formal nutrition standards in school. For our tribal communities here in Michigan, we only have two tribes that have their own tribally run school right now. We've had 1 or 2 other tribes that have started it, and then they've gone part of the public school system, which changed some of how they regulate their schools. But with that, we also help support at least 7 of the tribes' Head Start programs. So to the nutrition standards that a lot of our kids are kind of fed once they get to kindergarten really fall under whatever the public schools regulate as healthy food choices. And that's been a big part of the work for our community health staff across the state. Some of our tribal community health staff have good relationships with the local schools and, can be supportive and help developing healthier menu choices. But if they don't have that luxury, or if their children are spread out across districts, depending on how large the tribe is, there's really no bottom line standards. And so it's with the Healthy Start programs that a lot of our tribal folks are participating in, we can track some of our families and get them in to see where their BMIs are and to see how healthy they're eating and have a little bit of an influence in education. But once the kids get into kindergarten, that's really, really difficult. And then without a good partnership with the school and the state not having formalized regulation on good nutrition standards in schools, that's also a difficult kind of uphill battle for some of us. So with our project, there are 3 main assessment areas that we looked at in trying to develop a learning community and to getting the resources and messages out to the different communities that are participating, and then hopefully expanding that beyond those tribal communities as well. We developed a primary food access tool. We have a community resource tool and food system diagram. And basically what that boiled down to is our partner, Michigan Public Health Institute, looked at, they developed a tool that our tribes could kind of do a walkthrough of their entire community and look at who their current partners are as it relates to nutrition, education, good health for children, and decide who their best partners are. Who do they have good relationships? Who do they wish they had a better relationship? And they were able to develop some eco maps, which I'll show you here. They were developed some eco maps from that. And if you look at the baseline food system up at the top, you can see we have our 6 tribes in the blue dots. And then the only avenue that they had for working together or being able to collaborate together had a lot to do with a teaching resource, which happened to be our organization, Intertribal Council of Michigan, who brought them together for this project. But other than that, those tribal communities were kind of satellites on their own. They had a few partners that they worked with, and to really develop a collaborative and open up communication and find resources that not only are just in their community, but also available regionally and at the state level, we really tried to talk to them about, what other resources might be there. What Michigan Department health offices are available that are providing food access resources, what things are available through their local extension office that are offered statewide, and how can we really build on this collaborative so that we're doing more with the less resources that we have and partnering with others to kind of share in that load. And the last time we did this food system graph, this eco map, you can see that we started to have some more overlap. And for many of the tribal communities, their partnerships started expanding. Through this collaborative, everybody kind of shares their ideas. We get together on a monthly basis to kind of give updates and share. And folks were really excited by the change. We went from having like 96 or 74 partners identified amongst all of the tribes at the beginning of the kickoff meeting. We went from 96 to the second one, and now we're up to 227 agencies and groups that are working together at the end of year 1. And we know that's expanded even more, and we expect that our eco map at this next quarter meeting, which is next week, will have even more ties that bring all these tribes together. The community food resource assessment was a tool that then, after looking at the eco maps, that helped the tribes look at the quality and of each of the partnerships and the resources that were available in their local community. So they basically went to local stores, local gas stations, maybe the convenience store on the corner right there in the community, anywhere that was within a mile's walking distance or within a 10 miles to drive, somewhere where they knew a lot of tribal members were going, and kind of did an assessment on what kind of food choices were available to them. Some of the communities do have farmers markets that are underutilized by the communities, but yet they're available. So they even included some of those healthy choices that might be available, and did an assessment. What are people using? What stores aren't they using? They were able to speak to store managers. Some of the bigger chain grocery stores which you can kind of picture who those were, the big local commercial grocery stores and department stores. The managers were often more hesitant to talk to our folks and let them, kind of assess what was available and look at pricing and all that kind of stuff. But in the end, after explaining what they were doing, many of them found that they really liked the idea of opening up access for families, and they were really friendly, especially our small chain grocery stores and some of our, convenience stores, gas stations, distribution centers. They were really open in wanting to learn more about how they could move the healthier product, where to place it, how to advertise for it, and how to get families to make those purchases, which is kind of the next level of education then. And I'm going to pass the presentation over to one of my colleagues who's going to talk a little bit about the nutrition resources in just a minute. In addition to the assessment that we've done, our current strategies include a number of different things as far as the education level, that things that are happening on the ground with our families. Those include nutrition prescriptions through a partnership with Michigan State University Extension. Our tribal communities kind of took that idea of nutrition prescription and expanded it to a number of different ways. Some of our communities put together veggie boxes for their families, and then when families come to well child appointments, they're given one of those boxes. Or families can sign up for a nutrition prescription, or their doctor assigns them to a nutrition prescription, and the boxes can be delivered. It all depends on the community and their resources. One particular tribe found that the veggie boxes weren't working for them because many of the families weren't prepared to take the boxes in and do something with them before the healthy, the fresh fruits and veggies would spoil. So they turned to doing vouchers and letting the families go and purchase what they need. So if they're, if the family needed to include healthier portions of protein in their diet, they had a partner, that particular tribe had a partnership with a local meat shop and had vouchers for the families to use there. If the families had a need for more veggies in their diet, then they would go to the local store and they could use their vouchers specifically to buy the fruits and veggies that they were familiar with. But they also paired that with cooking classes, and all of our tribal communities involved are doing cooking classes of some sort with both the kids and with the families. A few of them have used their funding that we received through the Health Endowment Fund to purchase small little portable cooking elements, so they can make portable cooking kitchens and do demonstrations. One of the communities has been we've taken the idea of native fusion, which we'll talk about later on in the presentation, using those little blenders or bullets and making fresh smoothies for the kids, things that kids can do at home while they're waiting for parents to get there. Community gardens are starting to pop up again, and many of the tribes are now starting to form, if they don't already have one formed, farmers markets of their own. And those are starting to expand with partnerships at the state level that we're starting to make through a statewide farmers market network that's available here. There's also some local nonprofit organizations that are trying to increase food access and are interested in working with the tribe. So some of those things are all listed here in our current strategies. You can kind of look through those. Another big thing that we're seeing is an increase in traditional foods. People want to learn more. If they're going to eat healthy, they want to know what the traditional foods are. And so we've been sharing some recipes and, really starting to talk about that, how it is to eat seasonally. So at the end of the presentation, if anybody has any questions about our current strategies, we're happy to share more. So Hannah, would you like to take it over from here?
All right, thanks, Michelle. So one of the strategies that we've been working on through this Michigan Tribal Food Access Collaborative is increasing the number of nutrition education resources. And this is also a good strategy for healthcare professionals to use within their offices and their well child visits and things like that. Because nutrition education resources are those brochures and pamphlets that you have in your waiting room, and that you can hand off to your patients that really just give them a guide for basic nutrition information, some of them more specific than others. Information like how to incorporate more healthy options into your meals and where to find those healthy options, and also how to have conversations, whether it be parent to child or family member to child, about how to drive positive change in health behaviors, whether that be healthy eating, healthy exercise, whatever the case may be. Those resources are really important to lay a foundation of information for your patients to understand. And these are really, really helpful for healthcare professionals because it kind of frees up your time within your visit to talk about more of the individualized follow-up care or instruction to address maybe, healthy eating behaviors, and also ways to prevent obesity and overweight conditions. So one of the greatest outcomes of discussing these resources within your visits is that you're learning more about your patient. You're learning what kind of foods do they eat, what kind of foods are available to them. That way you can make your recommendations the most appropriately as you can. And I like this quote because it says, unless you ask, you won't be able to tell which child is going to bed hungry, and you won't be able to connect their families to resources like SNAP, WIC, or food pantries that will help them get good food. And even though this quote says they may be going to bed hungry, maybe your patient isn't going to bed hungry and they are struggling with issues like overweight and obesity. They may not have access to those healthy options. And by asking them, you're able to understand and recommend the best nutrition programs or things like that that may be able to help them get the foods that they need. And as research shows, healthcare professionals, in particular primary care providers or pediatricians, are most likely to impact the likelihood of participating in positive health behaviors. So things like healthy eating. So just having that conversation with them may change the way that they eat and develop diseases or conditions, like overweight or obesity. So as part of the Michigan Tribal Food Access Collaborative, like Michelle discussed, we went to 4 of the participating tribes to discuss the nutrition education resources that they were using. We talked with health staff, so people who interact directly with children and their families, to talk about which resources they're using, how they feel about those resources, and then also ask them what information or messages they wanted to see in future resources. That way it can be more specific to their communities and more beneficial to them so that they can use and get the benefits. And what came of those 4 conversations are right here. We kind of grouped them into 5 themes. And the first theme we have is that physicians need and also want talking points to have when they discuss overweight and obesity issues with patients and their families, as it is a really sensitive subject. And a lot of med schools don't really discuss or teach about nutrition in depth. So just having those lists of talking points on what to eat, how to navigate the conversation, and other things like that are really a need in these communities. The second theme is that there was a limited distribution of nutrition education resources. So people weren't really receiving those resources by anyone but the dietitians, is what we found. And that way, and you have to have a referral to go see that dietitian. So sometimes there was a lack of distribution. But as the conversation went on, we found that there was an interest in utilizing other people, like home visitors or social services, and also school partnerships, to distribute that information and provide the education that children and their families need. The fourth theme is that the conversation found that the resources in the future need to have more parental involvement, meaning that parents need information on what is healthy food because they may not know either, and what they can do to make healthy lunches, or what they can do with commodity foods to make them fun and taste good for their children to eat, and that are also healthy options. And the last theme, which I think is probably the most important, is that the cultural appropriateness of resources needs improvement. So this means that these resources need to have familiar faces on them. They need pictures of Native American children and families. They need foods that are specific to, band specific with traditional foods. They need foods that are seasonally specific. Just in that, although that theme rose from all these 4 different conversations, each conversation was different in what they actually needed. So I think it's important to develop your own resource for your own community to best fit those needs. A couple of Native American specific resources that are already out there are these 3 listed here. The first one is the Anishinaabe Food Pyramid, which came out to give a more detailed and Native specific response to the USDA's original food pyramid. There's also seasonal options on there as well, if you can see those. The second one, My Native Plate, kind of arose from the USDA's My Plate, and the Dene actually, made the My Native Plate so that it could be a more Native specific tool as well. And then also the one on the right, My Native American Power Plate, is just another adaptation of My Plate, and it has more of those traditional food options on there. It also has no milk. I don't know if you can see in the My Native Plate, there's a milk on the top right. What we found from a lot of our conversations is that dietitians don't like to use that just because of the milk on there, as Native Americans, have a lactose intolerance issue a lot of the times. So this one is just another adaptation and a resource that is out there. And now I will hand it over to Shelley to talk about collaborative networks to increase community resources.
Thank you, Hannah, and welcome everyone. Thank you for joining us today. In this next section, we're going to take a look at how important collaborative networks are in the prevention and treatment of pediatric obesity. As we know, these listed institutions, as we'll refer to them, play a vital role in making the local environment more conducive to healthful eating and physical activity. This also validates the old saying that it takes a community to raise a child, and what we've learned is that's so true. So we're going to look at the next few slides and zero in on some of the barriers and challenges that these particular institutions face, and take a look at some strategies that you may wish to implement. Whoops. You can see on this slide, if you read through some of the various challenges that healthcare professionals have reported. And at the very first bullet, it's understandable that if the healthcare providers are not receiving appropriate training in the area of pediatric obesity or the necessary communications skills for talking about it with parents and children, they won't feel confident talking about it during an office visit. So it's also been reported that healthcare professionals, some of them hold negative attitudes about individuals affected by obesity. And we refer to this as weight bias. And this bias may have a negative impact on the quality of care delivered. If they feel this stigma, it has been noted that the parents and families of the child are reluctant to seek follow-up care, schedule preventative services, and often are less likely to feel motivated to adapt family healthy behavior changes in the home. Another example that was noted occurs when the parent doesn't feel their child is overweight. So you can imagine the uneasy conversation at a clinic visit if this is stated. it also decreases a lack of motivation from the parent. And this is especially concerning as children rely on parents for guidance. Support systems have also been reported by healthcare professionals as being minimal or sometimes none at all. And with the limited time of office visit that they have, this can be a real challenge. And we refer to this as lost opportunities. In this next slide, we're going to look at some strategies for healthcare professionals to think about and implement as warranted in their communities. As common sense will tell us that if education and skill development is taught and continued with continued education, this is going to increase the confidence in healthcare providers, and they'll be more apt to deliver the necessary discussions during office visits. And so if we look at also being proactive, one example for healthcare providers to promote is the importance of breastfeeding in the prevention of pediatric obesity. This has been researched and found to be instrumental in the prevention. We also like to encourage healthcare providers to utilize tactful and age-appropriate language, and of course this is going to be done with more in-depth training. And if they implement a short list of talking points, which Hannah referred to before, this is also recommended, not only for the language, but also to assist in hitting all of the measures within the ICD-10 coding system, and ultimately increase the quality of care delivered. And healthcare professionals are such huge advocates and role models in the community, and they play a vital role in promoting good nutrition and physical activity. So if they can get involved in schools, community settings, healthcare clinics, it will be instrumental to help the children. At this point, I'm going to turn it back over to Hannah for a couple of slides.
All right, thanks, Shelley. So one clinical improvement that healthcare professionals can use is incorporating this hunger vital sign into your existing paperwork. The hunger vital sign is a validated 2-question food insecurity screening tool. It's recommended by the American Academy of Pediatrics, and it's used to understand food insecurity issues with the patients that you're seeing. And it enables you to refer your patients to federal nutrition programs, as well as community resources and services such as, like a visit to the dietitian. And in order to be able to refer your patients, they need to screen positive for this tool. And to do that, they need to answer often true or sometimes true to one or both of these questions. So it's a really easy tool. You can just incorporate it into your paperwork that you fill out at the beginning of your visit. You can ask it verbally, but you do need for them to check one of the boxes. And it's just a great way to connect patients with the resources that they need. A few at the bottom here are alternative food insecurity screening tools. And that's the Survey of Well-Being of Young Children. There's also the We Care screening tool, which I'll let you read that whole long title. And then there's also the Safe Environmental for Every Kid SEEK Parent Screening Questionnaire. Those are all tools that you can use to screen for food insecurity and connect the resources that your families and children might need. And once you have screened and your patient has screened positive, you're able to use ICD-10 codes for patients, so that way you can bill your insurance companies and maybe sustain some positions like the dietitian's role. That way, when you screen and you use the ICD-10 code, you can use either one of these two, the lack of adequate food and safe drinking water, or you can use the extreme poverty code. It's really up to your discretion, whichever one fits your patient a little bit more. And any intervention like referring your patient to a dietitian or any other intervention that you might have, it has to be documented and tracked in your patient's record. That way the ICD-10 code is warranted. And I want to highlight this website here, cms.gov. It's a great website. You can find any ICD-10 code you need. It's not specific to childhood obesity. It's any ICD-10 code, so it's very useful. You just type in the code, or you can type in a keyword. Say it's nutrition, or say it's exercise. You type that in and it will bring you every code that is related to that word, and vice versa. Yeah. And then once you have screened and you know that your patient might need some help, there are some nutrition programs out there that you should know about. The list right here includes SNAP, WIC. Double Up Food Bucks is a great one. It enables your patients to try a few new foods if they, don't really want to spend the money on it, because you get double the money or double the food for the money that you have. One recommendation that I have, if you decide to recommend your patients to a federal nutrition program or a program like one of these, is that you have somebody designated in your office to sign them up for those programs before they leave, because we know that motivation decreases, and maybe you hear about these great programs and you go home and you have the paperwork, but you just don't feel like filling it out. Having somebody designated in your office to give the immediate assistance and guidance that they need to fill out those programs, you know that your patient is walking away with more resources than what they came in with. And now I'm going to hand it over to Shelley again to talk about communities and their challenges and strategies.
Okay, thank you, Hannah. We'll turn our focus now on the next institution, communities. And as we think about the challenges communities face, we see on this slide that ultimately we have found that children are not getting the proper amount of nutritious foods and not enough physical activity opportunities. So we'll take a look at some of the barriers. I apologize, my mouse is like all over the place there. I don't know what's happening to my, oh geez.
All right, stand by.
I'm having technical difficulties, so I apologize.
Yep, let me see if I can get this going here.
Okay.
What slide were we on there?
23.
That's 23. Collaborative network to increase community resources, health professionals, barriers in addressing childhood obesity.
Strategies for communities is the title of it. There we go. Yep, back up one more. Thank you for your IT expertise. One more. One more communities. Yeah, one more. No, that was forward, just backwards. Right there. Perfect. Thank you. Maybe I'll have you switch when I say next. I don't know. So we'll quickly talk about some community strategies, and each of you have your own story of community challenges, but we can all agree, however, that the prevention of pediatric obesity is ultimately about community, which extends beyond individuals and families. So when you look at your own community, it's really important to implement relevant communications per your community. There's been some wellness initiatives that have been implemented that have been very successful in communities, and this is a great way for all of these institutions to work together for the common goal. That's having health clinics, schools, childcare programs, work sites, all working on the same initiative, and it builds a strong bond and in turn helps the children. In order to promote change, it's been found that it's vital to build on the strengths and traditions within your community. This also includes to improve on the already built community strategies, which is through safe sidewalks, roads, safe places to play, and new and improved community facilities. Next slide, please. The last institution we're going to focus on is schools and child care programs and the barriers that they face. And you can read through this slide, but basically in a nutshell, there's various challenges that we all face in the areas of nutrition and physical activity for children, which is costs, available support, physical activity opportunities, and lack of staff professional development. School staff and child care providers have reported frustration in this area because oftentimes they are implementing nutrition and physical activity curriculum in the schools. However, when the child goes home, these are not being implemented at the home base, so that increases the risk for unsustainable healthy behaviors for children. So there's that gap that we're hoping to breach, and that can be done through parent workshops, staff workshops, school workshops, so that everybody's on the same page. Next slide, please. When we look at strategies for child care programs in schools, the positive news is there are currently several tools available that are excellent for promoting healthy lifestyles for children. And as you can read through this slide, the classroom provides an excellent learning environment for teaching healthy nutrition and physical behaviors, and staff serve as a very positive role model for the children. We figure how many hours they're spending a day, whether it's at childcare or in the school. So when you involve children, parents, and teachers, childcare providers, and key community leaders in wellness workshops and family engagement opportunities, there's been a huge success rate when this is done in collaboration. The other important program that a lot of childcare programs in schools can utilize are food programs such as the CACFP, which is the Child and Adult Care Food Program through the USDA. Also, Head Start programs are extremely committed to promoting healthy eating and are an excellent supporter for the prevention of pediatric obesity. They offer great resources and programs if you want to check out their sites as well. This is the main point to take away from these barriers and strategies for these specific areas is that the impact of these important institutions in the lives of children can make a sustainable difference in their health for now and in the future. And on that note, I'm going to turn it back over to Hannah.
All right. So here I just have some nutrition education resources or some references. I have 3 slides. This first one is for clinicians. The first one on here is from the Academy of Pediatrics, and it's the toolkit addressing food insecurity. And it's such a helpful tool for me. It really goes through all of the different topics and recommendations on how to address food insecurity with younger populations. And I really urge you to take a look at that. There's also a few on here with, there's a coding one, talk about which codes you can use, as well as policies, goals, and recommendations. So really some great resources here. This slide is more for the health providers or educators. So, clinicians can also use this and vice versa, but there's a really interesting one on the bottom. I'll let you read through the rest of them, but really take a look at these. They're awesome. The last one, though, is Native Infusion, Rethink Your Drink, and it's a guide to ancestral beverages. It really urges people to infuse their own drinks and kind of shy away from those sugar-sweetened beverages that are causing so much damage and tooth decay and sugar spikes and everything like that. So just kind of a fun one that you could maybe implement in a farmer's market or something like that. The last slide I have here is more for families, but educators and clinicians can also look at it. websites are available here. The Ellen Satter Institute has various resources. On the right there's a Lakota Nomadic Traditional Food Wheel, and USDA and the Academy of Nutrition and Dietetics. All of these have wonderful resources that you can refer your families and children to take a look at. Some fun tips and tricks as well. Here are those resources that I had mentioned. You can find all of those on the previous slides. The Native Infusion Rethink Your Drink is the middle one, and that toolkit that I really liked is on the right. And then just a few more. There's the 2 Bite Club and Grow It, Try It, Like It from USDA. Those are fun ones to read through with your children. I don't know if that's more of, the health educators or people that might have more time devoted to spending with children and explaining that. Also, the Rural Health Information Hub is a great tool because, as we know, a lot of Native American communities are in rural areas. So there's a toolkit and best practices for those locations and those kind of populations. A few more resources available here, and I'll turn it over to Michelle.
I'm just going to be really brief on this too, because I see it's getting close to time for questions. But so this is another healthy food playbook. This is another toolkit that our group has recently learned about that a lot of people found useful. When you go to the website, which you can see the URL at the top in the bright green, there are a number of different strategies that people have been reporting on the work that they're doing in their own communities. And they're from all different cultures, all different types of communities, all over the U.S. And so I just wanted to include this on here because it was also confirming for our group as a collaborative to look and see the number of strategies that we were already implementing in our communities. And it was really motivating for us to hear stories from other people and, find those little tidbits that can help improve our own program. Like, oh yeah, we were doing that, or we used to do that. Maybe we should do it again because it is meaningful and it fits in with our work. So that's another great toolkit, playbook. There's a number of different things on that website. Let me see if I can get this to turn. There we go. Hold on just a second. Mike, can you turn the next slide? There we go. Okay, so another one of the things that we mentioned before were developing your own resources. And with the National Native Network, we work with a number of partners across the country. And one of our partners in Alaska is doing similar kind of work and developed their own food resource guide, and they used input from a number of our tribal partners. So that guide can also be found online on the National Native Network's website, which Mike, when we turn it back to Mike, he'll give you those resources. But you can see a picture of what that traditional food guide looks like. And that will give you a list of a number of books and resources that other tribes throughout the country have put together. That most of them are free. There might be a few that you have to pay for, but most of them are free, or at least the research is free. And that also has been a really handy tool for some of our tribes in motivating them to do more within their communities and try to capture the local recipes. This page is basically just some of the references, the research that has gone into the work that we've done, developing our collaborative and checking and double checking the work that we're doing to make sure we're on the right track. So feel free to use anything here. And that is it for myself. Mike?
All righty. Thank you, Michelle. And we've got probably about 10 minutes for questions and answers. The first question that we had is, can we get access to these slides after the webinar? And yes, we do have a webinar archive section of our website. So if you go to www.keepitsacred.org, again, that's www.keepitsacred.org. You're going to see a menu bar on the left side. You click resources, And under resources, you should be able to see the traditional foods toolkit, but you'll also see a tab that says webinar archive. So if you click on that, probably if you want to give me about an hour to get everything turned around and updated, we will have the slides along with the video from the webinar up on that page. So go to www.keepitsacred.org, click resources on the menu bar on the left side, and then click webinar archive. And I'll have the video and the slides from the webinar up there. And then we do have another question that says, can these tools be downloaded free of charge? So all the resources were offered in the presentation. I don't know if any of the presenters have anything to add to that.
This is Michelle. Yeah, there's a large number of them that are free. There are a few that you may have to pay for. I know Native Fusion was, we've got an initial copy of all of those toolkits and resources free for sitting in on their webinar when Valerie Seacrest did a presentation. So you might find an archive of that presentation and be able to download something. If you want hard copies, those we did have to pay for. Some of the materials we've used from USDA or CDC, a lot of those are free. The 2 Bite Club and those other books that were referenced on there, you can, if you go online and register, you can get, I think it's up to about 20 copies that you can distribute for programming. So yeah, most everything that we do, we look for PDFs or things that wouldn't cost too much to add to our resources.
Awesome, thank you. And just as a quick plug here, we do have another webinar archive, or another webinar coming up next week on June 27th. It's CDC's Cancer Control Efforts in Indian Country. And if you go to www.keepitsacred.org, and if you go on the left side and you click events on the menu bar, you should be able to get into the event on June 27th. To register for the webinar, and registration is open right now, and you want to make sure that you don't miss out on that. Again, we have a webinar coming up on June 27th called CDC's Cancer Control Efforts in Indian Country. We do have another question here. It says, what is the #1 reason for kids' obesity? What do you think it is in your community?
This is Michelle. I'll let the others also respond to this if they like. But for me, there's been a huge shift in our traditional diet. And for Native American folks, our biology has not yet caught up to the type of food that we're eating. We're not eating a traditional diet. We're not eating off the land and seasonally like we used to. And so, our bodies aren't able to process the same kind of food that we're often eating. The second thing is the lack of physical activity that our folks are engaged in. Many of our families are single family homes, or they have children who are spending more TV time and more video game time. And so they're just plain not active. And, metabolisms sometimes vary from biology to biology, but for Native American folks, we need that outdoor time. We need that physical activity time to really keep things moving. So, there's always those number of factors. A lot of the foods that people know as nutritious are not always as nutrient dense as they need to be either. So people who feel like they are eating healthier may not be. We know about iceberg lettuce does not have the nutritional value that, say, a spring mix might have or something like that. So it's really as much environmental as it is the interruption from boarding schools where families just aren't really sure what's healthy or not healthy.
This is Hannah. I just kind of want to add to that. One problem that we found in the conversations with the tribal communities that we visited, were that commodity food offerings they're offering, healthy foods, and people are taking them, but maybe aren't using them or don't know how to use them, which is why offering these education resources is so important. And yeah, just not knowing really how to make healthy foods, or maybe they don't have the budget to get the most healthy foods, or they don't know how to stretch their budget is, I think, a big issue.
Okay, and we do want to remind everybody to complete the post-webinar survey. We will be sending out an email out of our GoToWebinar platform tomorrow, and we want to encourage everybody to please complete that post-webinar evaluation. And if you do that, then we can go ahead and work with IHS Clinical Support Center to offer continuing education unit certificates to everybody that completes that survey. Okay, so this person says, thank you for your presentation. Has the collaborative discussed how tribal communities might utilize CHWs, CHRs, or other paraprofessionals in providing basic nutrition education? If so, what is the collaborative thinking around this?
Can you ask the question part of that again one more time, Mike? I missed part of it.
Sure. Thank you for your presentation. Has the collaborative discussed how tribal communities might utilize CHWs, CHRs, or other paraprofessionals in providing basic nutrition education? If so, what is the collaborative's thinking around this?
Okay. So yeah, that's one of our big things. We started off with coordinators from each of the tribal communities. One or two of them were already the CHRs for their community. We had a dietitian. We had 2 tribal health directors on board, and that was, that was a big part of our thinking, is that yes, we want to take this information and get it out. So, our CHRs and our CHWs are looking for things to engage the community. They're going out and doing health fairs. They're trying to be the ones who are part of the distribution or getting involved in the farmers markets themselves so that their faces are being seen and the information can get out. But we know that their time is limited too, and they can't always be those people to do that. So that's where we're working with our tribal home visiting staff and trying to, give them that information. So they're working with the CHRs in their community to say, what else can we bring to families? Like, when, we have this family who we know their dollar never stretches, they never quite are able to get the healthiest food choices, what kind of information can we bring to them? We have a hard time getting families to come in for referrals, so, we're looking for those other ways to get into families' homes. Our Head Start programs, we're working with the Head Start teachers to, the community health and the medical health staff will sometimes give them information, and then vice versa. The Head Start staff will, try to be informative. We'll try to inform community health or medical staff about issues going on in the community, or, patterns that they're seeing in families with health and nutrition. We're also, the conversation that came up in our discussions was with social service staff. They're often frontline people who are working with families, and how is it that we can get them involved in the nutrition, healthy eating conversation? Because we know as an intervention, that could be something, food has always been something that brings our families together. And the trick is, when building a collaborative, is to try to make it such that it's meaningful for everybody involved. We're not trying to create more work for any individual. We know everybody's wearing 2 or 3 hats, and sometimes that's hard to convince people. One of the big things about the collaborative is being creative and inviting people from different parts of the community, different departments that you might not think about. Think about youth services, think about Boys and Girls Clubs if you have the luxury of having them in your communities. They've also been a proponent of being able to do workshops. A lot of times our community health staff will do community events and nobody shows up. You put all this time into it and nobody's there. So our staff have found that by working outside of their own department and really being part of this collaborative group, they've been able to really get larger audiences. And even if not all the families come, they're getting the messages to more children who next time will bring their families, and vice versa. Families will come, and if we make it family friendly, they'll bring their children, and then the whole pod is getting educated. I don't know if it came up, but one of the things, with the pediatric obesity is if you have one child whose showing up as obese or overweight, then likely the other children are too. And so how do we make that a whole family learning experience?
All right. And with that, we're about out of time. It's about 3:59, so out of respect to everybody's time that are participating and presented on the presentation, we're going to go ahead and wrap things up. Feel free to follow us online. Our website, again, is keepitsacred.org, and all of our social media platforms are listed on the screen. We're on Facebook, Twitter, LinkedIn, and Instagram, so make sure you follow us to stay up to date. And one last plug, we do have our next webinar coming up on June 27th, CDC's cancer control efforts in Indian country. And with that, we'll go ahead and wrap it up. Thank you to everybody for attending, and thank you to our presenters for presenting this fantastic presentation. Have yourselves a wonderful day.